Welcome to our module, Civility, Incivility, and Aggression in the Healthcare Workplace. This topic is one of the most pressing challenges in nursing leadership today. We often think about clinical skills, but workplace culture is just as critical for patient safety and staff well-being. Incivility can seem like just a bad mood, but it can quickly escalate into aggression that harms both staff and patients. In this module, we'll explore strategies to build cultures of civility, equity, and justice in healthcare organizations. We'll also look at how leaders can manage conflict constructively and address workplace violence. Think of this session as both a mirror and a toolbox. It helps us reflect on our own behaviors while also equipping us to lead change. My challenge to you, as you listen, consider your future leadership role. How will you set the tone for civility in your unit? Civility is more than being polite. It's about creating an environment of respect and psychological safety. When people feel valued, they communicate more effectively and make fewer errors. On the other hand, incivility and aggression can erode trust, increase burnout, and even lead to patient harm. Think about the times you've seen gossip, dismissiveness, or eye rolling in a meeting. Those small acts might seem harmless, but they can snowball into a toxic culture. Leaders play a huge role here because how you react to stress sets the tone for everyone else. Our primary outcomes for this course are to promote workplace civility and to manage conflict in constructive ways. In short, civility isn't extra. It's the foundation for safe and effective care. And yes, it really does make the workday a lot more pleasant too. Workplace civility doesn't happen by accident. It requires intentional leadership. Social justice means recognizing inequities that shape how people experience work. Anti-racism goes further by dismantling the systems that create or reinforce those inequities. Equity ensures everyone has access to the same opportunities for growth and advancement. One tool leaders use is the Just Culture framework, which balances accountability with system factors when evaluating incidents. This means we avoid blaming individuals without looking at the bigger picture. As a leader, you'll need to cultivate an environment where diverse perspectives are valued and psychological safety is a priority. When people feel safe to speak up, they are far more likely to raise concerns that prevent harm. Think of yourself as both a gardener and a guard. You plant seeds of civility while also protecting them from weeds of incivility. If civility is the foundation, then communication is the glue that holds the workplace together. Civil communication involves active listening, respectful tone, timely feedback, and transparency. Uncivil communication, on the other hand, looks like interrupting, dismissiveness, or withholding critical information. Leaders must model therapeutic communication, empathy, curiosity before judgment, and cultural humility. Closed loop communication in critical situations can literally save lives, and when tension runs high, de escalation skills become essential. Remember, people often copy what their leaders do, not what they say. If you communicate with respect, even under stress, your team is more likely to follow suit. Bottom line, your voice sets the soundtrack for the workplace, so try to avoid turning it into a horror movie. Conflict in healthcare is inevitable, and honestly, that's not a bad thing. We work in high stakes, fast paced environments with multiple disciplines trying to collaborate. Naturally, differences in roles, communication breakdowns, or competing priorities can cause friction. The important thing is whether conflict becomes constructive or destructive. Constructive conflict focuses on issues and solutions, while destructive conflict gets personal and erodes trust. As a leader, you need to recognize which way the wind is blowing and redirect destructive patterns. There are several models for conflict engagement: Thomas Kilmann, interest based problem solving, and transformative mediation. The key is not to fear conflict, but to use it as a catalyst for growth and innovation. In other words, don't aim for a conflict free unit. That's unrealistic. Aim for a conflict smart one. When you're managing conflict, preparation is everything. Gather the facts, understand the underlying interests, and control your own emotions. Timing and setting also matter. Sometimes a hallway confrontation is the worst place for a serious discussion. During engagement, focus on active listening, use I statements, and validate different perspectives. Always aim to identify shared goals like patient safety or team effectiveness. Resolution means generating options together, documenting agreements, and planning follow-up. Difficult conversations require psychological safety, separating people from problems, and addressing patterns instead of isolated incidents. Leaders who do this well model emotional intelligence and self-regulation. The goal isn't to eliminate conflict, but to turn it into a force for innovation, like harnessing fire to cook dinner rather than burn down the house. Sadly, workplace violence is a major issue in healthcare, and nurses are at the highest risk. This includes lateral violence between peers, vertical violence across power levels, physical aggression from patients, and even sexual harassment. Warning signs might include rising turnover, information hoarding, or cliques forming within units. High stress environments like emergency departments or psych units are especially vulnerable. The impact goes far beyond staff morale. It can increase medication errors, suppress safety reporting, and cause burnout. Financially, turnover costs can reach tens of thousands of dollars per nurse. As a leader, recognizing and addressing these risks isn't optional, it's essential for safe patient care. Ignoring bullying or aggression sends a message that it's tolerated, and that can be devastating. Remember, silence is complicity. Prevention and response to incivility require both system-level policies and individual skills. Prevention starts with clear codes of conduct, civility training, and team building. Adequate staffing and workload management also reduce stress that fuels conflict. Reporting mechanisms must be safe and anonymous, with a just culture response to avoid blame. Intervention includes graded responses, immediate de-escalation, mediation, and providing support to staff. During crises, leaders serve as anchors, modeling calm, providing clear direction, and ensuring resources are available. A zero-tolerance approach to retaliation is critical to build trust. Your role as a leader is both to protect your team and to hold people accountable consistently. Think of yourself as the thermostat, not the thermometer. You don't just reflect the temperature of the workplace, you set it. Changing culture is a long game, often taking 3 to 5 years of consistent effort. The first step is assessment. Surveys, focus groups, and climate tools to identify specific issues. Then, leaders develop strategies addressing policy, education, accountability, and environment. Implementation should start with highly visible actions to show commitment, backed by skill building and recognition for positive behaviors. Resistance is natural, so transparency and involvement are key. Evaluation requires ongoing measurement, sharing outcomes, and adjusting strategies as needed. Evidence shows that aligning systems, processes, and behaviors is what sustains change. As a leader, you must champion civility not as a nice to have, but as essential to organizational success. And yes, you'll probably repeat yourself often, but repetition is the mother of culture. Let's bring it all together with a case scenario. Imagine stepping into a unit where staff are divided into cliques, newer nurses feel excluded, and patient satisfaction is dropping. Errors are rising, and the culture is toxic. Where would you start? You might begin with assessment strategies like surveys and observation to understand the scope of the problem. Then you'd need to address immediate safety concerns like communication breakdowns. Long term, you'd model civility, engage stakeholders, and develop a civility action plan. This plan should include assessment methods, interventions, timelines, and evaluation strategies. The big takeaway: civility requires intentional leadership, continuous effort, and a belief that culture change is possible. Your challenge: how will you lead the way toward a healthier, safer, and more civil workplace?